All right. What are some, so going back to like the recovery when they're coming to physical therapy, what are some tips that you can give a patient, anyone out there, that they can use in order to help speed up their recovery?
Yeah, great question. So to kind of piggyback on what we've already talked about, the common mistakes of not eating enough and not having enough quality, some quick tips would definitely be let's make sure we're eating something every 3 to 4 hours in an effort to eat more and enough.
Okay.
Every time you eat, have a source of protein. Every meal, every snack, we want that quality protein again. We want those complete amino acid profiles when possible. Eat a fruit or a vegetable every time you eat, and that kind of goes into having a variety of whole foods, right?
Okay.
Each food gives us different nutrients. In my experience, even the client who eats the cleanest, if they eat the same thing every day, monotony is the enemy. They're going to miss some micronutrient. That's another caveat for test, don't guess. A service that TNT is going to be offering in the near future is micronutrient testing. I've actually been tested myself. I thought it was fascinating. I was deficient in calcium. I was like, what? That's crazy. But it was really interesting. So I think to have that variety is really helpful. Another good tip would be to have plenty of complex, nutrient-dense carbohydrates. So be okay with the sweet potato, the quinoa, spaghetti squash, beans, things like that. Really those nutrient-dense powerhouses. And don't be afraid of those healthy fats. There is a high correlation between low-fat diets and risk for injury, especially with female athletes. So we want to make sure that we've got plenty of avocado and olive oil, nuts and seeds, flaxseed, fish, things like that.
Okay.
So plenty of healthy fats as well.
Got you. Can you give them an example of the complex amino acid that you mentioned earlier that they should?
The complete amino acid?
Complete, I'm sorry. Complete,
no, it's okay. Yeah, so all foods that give us protein, if they're from an animal source, they have what we call a complete amino acid profile. So we have some amino acids that our body can actually synthesize and make themselves, and some that we cannot make, we need to eat those. So when we eat animal sources of protein, we get all of the amino acids that we need. If you are a vegetarian or you add in some vegetarian sources of protein to your diet, like beans or quinoa, things like that, you get it what we call an incomplete amino acid profile. So you might only get some of the amino acids that we need, but you don't get them all. There are ways to still be, obviously, a healthy vegetarian and get enough protein. You can eat what we call complementary proteins. So if you have rice and beans together, or the verdict is out on timing, but around the same time, they are complementary and complete proteins now. So that's kind of a quick answer for that.
Gotcha. And speaking of timing, when should they eat before, like in terms of, they have an appointment, physical therapy appointment at 3 o'clock. When should they eat, and then how soon after their appointment should they eat?
Yeah, good question. So remember, now we're going to start eating every 3 to 4 hours, right? Physical therapy is what, about an hour-ish?
About an hour, yes.
Depends. And I've had the pleasure of having some physical therapy sessions with you. I know they're no joke. They're pretty intense, right? So I'm going to go with just my general exercise recommendations, which would be probably anywhere from 1 to 2 hours beforehand. You want some complex carbohydrates, a little bit of protein, and a little bit of fat. So that threshold, that time, 1 to 2 hours, is different for everybody. If you eat an hour before and they get in here to work with you and they feel a little sick on their stomach or crampy, they probably need to extend that window a little bit. If the food choice that you eat is too high in protein or fat, what happens is digestion takes a little longer, so blood is now rushing to your digestive system to obviously digest the food, and it's not pumping blood to your lungs and your muscles and all that kind of stuff. So that's usually why people cramp up. So probably 1 to 2 hours beforehand, but that's really per tolerance.
Okay.
Yeah.
That makes sense. All right, so hot topic we'll go to, right? So in the acute phase, if I sprain my ankle, a lot of times it swells up, right? So it's already an inflamed state. So our goal is always try to minimize, or try to minimize that, get some movement and some blood pumping back out of that particular area. Now, should they avoid certain foods that have, for instance, gluten or anything, something that has inflammatory factors, while trying to rehabilitate in the early acute phase?
Great question. Such a hot topic right now, so I'm really glad that you asked. I have a little different perspective on this. I work with a lot of autoimmune and digestive disorder clients, so we do a lot of elimination diets and try to figure out, do they have an underlying allergy or intolerance that hasn't been identified that's exacerbating their symptoms. So I do think there is a time and a place to eliminate foods that are irritating to your system and don't agree with you. Kind of goes without saying that if you're intolerant to something and your body is under stress and in an inflammatory state, you're just going to make that worse. So there's definitely a time and place to remove some of those things, but I think if I was to make a blanket recommendation of you're in an acute healing phase,
right.
Cut out gluten, that would be really narrow-sighted of me, really narrow-minded. I do want to just give a little quick warning to that if a client decides that they do want to go gluten-free because they read that this was the best
right.
thing to do for healing, really just be conscious and check yourself on, when I cut out gluten, what am I also cutting out? And that kind of goes back to when we talked about not eating enough and not having those quality building blocks. If they blindly cut out gluten, they're going to lose fiber and carbohydrates and B vitamins, among other things.
Mm-hmm.
So as long as you're cutting that out but adding those other sources back in, you're going to do an okay job and you're going to be fine. But I think that's not a one-size-fits-all answer. It's very individualized, so that would be a good idea to work one-on-one with a dietitian or nutritionist to help you figure out if that's most appropriate for you.
Okay.
Yeah.
And one quick question. So there was when I would rehab my ACL,
Mm-hmm.
there was a friend of mine that told me you need to eat better, of course, for your healing, but also more vegetables. I know vegetables are good for everyone, but any correlation with the more vegetables you eat,
Yeah.
the better, in terms of healing or something?
Good question. Yeah, when you asked me a couple questions ago about like quick tips, one of the things I said was every time you eat, incorporate a fruit or a vegetable.
Right.
But let's just think about the post-injury state, right? We have inflammation, which can increase free radicals, which can lead to further oxidative stress and damage. Your immune system is suppressed during that time as well, right? So your body's under a lot of stress. And the thing we know to be true about all those micronutrients, those vitamins and minerals, is some of them we need to get every day or we start to become deplete in those. Vitamins in particular, we've got what we call fat-soluble vitamins, but we also have water-soluble vitamins. So the fat-soluble ones, A, D, E, and K, we store excess of those in our fat. But water-soluble vitamins, though, we don't have a store of those on hand at all times. So like I said earlier, monotony is the enemy when it comes to your diet. Even if you eat very clean, but you don't have variety to the foods you eat, you could be unintentionally missing some of those micronutrients that you really do need to replace every day. So everybody can benefit from eating more fruits and vegetables,
Right.
but definitely the client who is going through rehab is really going to benefit from that.